Hi, my name's Martha Luke. I'm the author of Getting Through Tough Times with HealthyPlace. In this video, I want to talk about depression spells. Now, regardless of whether or not you were diagnosed with depression, you've had a depression spell. The difference between just having the spells and having the condition of depression is that with the spells, they can come and go at any time. They can last for seconds, minutes, hours, maybe even a couple of days. Whereas with depression, the symptoms last at least 2 weeks and they're constant. The problem with recognizing a depression spell and the actual condition is that people who have antidepressants assume that just because they're on the medication means they'll never get depressed. This is not the case. Anybody at any time can get depressed, but the symptoms last a shorter period of time. So even if you're on medication and you feel depressed, doesn't necessarily mean that your depression is getting worse, and it doesn't necessarily mean that the medication isn't working. The medication makes depression more manageable, and it makes it so that the symptoms won't last at least 2 weeks and it won't be life debilitating. Now, I've had depression spells at work as well as oftentimes at night, especially when I'm having the depression spell at work. It usually lasts like 15 to 30 minutes, and I can go somewhere where I can just take a few deep breaths and remind myself that everything is okay, and that and that it's just a spell, and maybe being around people will help it go away. That usually works pretty quickly. Whereas when I have a depression spell at night, it can sometimes last all night, and it can be triggered by thinking about the future or thinking about something that happened that day or even months ago, and then wondering, is it going to happen again? And what's going to happen next? It's really hard, especially at night, but usually what helps me is praying and talking to my loved ones, texting somebody, um, or messaging them on Facebook. Although I have to be careful about that to not spend a lot of time on Facebook. But if you have a depression spell and you think that the medication isn't working, or if you think that it's going to last forever, I'm going to tell you right now that it might just take a little bit of time and talking to your loved ones to get through it. I have been there. It gets better. And I hope that if you have a depression spell, that you can overcome it and that your loved ones will be there to help you. If you have any insights on this video, or if you have any experiences of your own that you'd like to talk about, feel free to put them in the comments. Thank you for watching this video. Bye.